Let's explain the revolutionary method of neuromuscular massage therapy. It's an incredible, skilled, highly effective method of soft tissue therapy, massage, bodywork, to get rid of pain, soft tissue pain, right at the source. It targets pain quickly right at the source. So as a system, neuromuscular massage, revolutionary method, is a system of treating soft tissue pain and dysfunction. It includes a detailed posture assessment to look at somebody's posture, look at the muscle imbalances, which muscles are pulling the person out of alignment, which muscles are short, which muscles are tight, which muscles are causing pain. So it includes this detailed posture assessment that looks at which muscles are pulling people out of alignment, posture, being deviated off, and muscle imbalances. It also includes the method, which is not only treating trigger points, which are the landmine knots at the source of 80% or more of pain, not only treating trigger points, but also treating the muscle belly, which is what like other types of massages do, like deep tissue, but neuromuscular treats the muscle belly more detailed and specific. And it also treats the attachments of the muscle, the tendon attachments of the muscle. So it also treats ligaments as well, and it also treats fascia. So it really is the most detailed, specific, targeted method there is, hands down out there, of treating and releasing and getting rid of muscle pain for good. What is the revolutionary method of neuromuscular massage, and how is it different from all other types of massages, including deep tissue and Swedish? Swedish massage is your classic relaxation massage. It treats the muscles lighter, it's full body, it's what you see classically like the oil massages in movies, but it's also like very common in spas, and it's really good for relaxation. Then you have deep tissue, which is using more pressure. Deep tissue uses more pressure than Swedish. It's often full body, and it can also release muscle tension and specific tight muscles as well, because you're going deeper pressure. Often people who want like firmer pressure than a Swedish, they think in their minds they want deep tissue. Now, what is neuromuscular's massage, the revolutionary method? Well, the revolutionary method of neuromuscular massage, it does kind of like what Swedish does initially for warming up the tissue, very light. It treats the muscle bellies just like deep tissue does. It treats the muscle belly with pressure. So it does just like deep tissue, but more effectively. But it also includes more specific, targeted, detailed treatments on the entire muscle, including not only the muscle belly like deep tissue, but the tendon attachments that are connected to all the muscles, which by releasing these tendon attachments, the neuromuscular massage is able to then get more relief out of the muscle. It releases the muscle even more so that clients get more longer lasting relief. Neuromuscular massage also works the ligaments, and it also works the source of the pain and tightness inside the muscle called trigger points. And that's the source of over 80% of chronic pain. So not only does it do what deep tissue and Swedish already do, but it targets, laser focuses in on muscles specifically to release them, their attachments, and the landmine knots called trigger points that are inside all the muscles at the root cause of the client's aches and pains. The revolutionary method of neuromuscular massage also includes a detailed posture assessment. Typically, Swedish for sure does not do that, and pretty much 99.9% of deep tissue therapists, 99.999% of deep tissue therapists do not do posture assessments. They're really just throwing the client right on the table and then just doing a full body, deeper pressure massage. But neuromuscular, the revolutionary method, first we'll look at the posture to see which muscles are short, tight, pulling the client out of alignment, and at the root cause of the tight muscle that is at the root of the trigger point causing their pain. It actually will figure out more of the source of their pain because the blueprint is the posture. So the neuromuscular therapist can look at your alignment before the treatment, before just throwing them on the table and say, this is what's causing your pain more than this area. So those are the differences. Neuromuscular is really a much more effective type of bodywork. It's a system for getting rid of chronic pain, aches and pains. And usually when a client wants deeper pressure and more relief, and they're saying they want a deep tissue, pretty much always they really want what neuromuscular therapy delivers. They want specific targeted relief on the muscles. That's really what they're asking for. So if they really love and like deep tissue, they're going to be blown away by neuromuscular massage.